I think we're going live. So namaste, everyone. I'm your host, Priyanka Deo from New India Junction. And before we start, let me talk to you a little bit about ICANN because it's a tremendous sort of initiative that's taking place during the COVID-19 and during the national lockdown in India. Now, ICANN, which is India Co-Win Action Network, is a great initiative to help underprivileged communities that have been hit the hardest due to COVID. And they do that through a online platform like the discussion we're about to have that connects those who are in need of help with those that can provide it. Now, Co-Win warriors work from home. They activate their communities on the ground in multiple ways. They connect and ensure that vulnerable sections of society also sustain themselves, and they're spread across multiple states all across the country. And I just got data, which is quite incredible. Over 69,000 lives have been impacted by the ICANN network. And we have close to 4,000 Co-Win warriors all over the country. I believe the figure is just above 3,700 and over 2,000 NGO partners. With that being said, I'm really excited to have this dialogue today because we have multiple panelists across all time zones in the world that are willing to join us and talk to us. So let me just give your names, and why don't I give all the names, and then we can go to individual introductions. So first up, we have Miss Sonal Chinchavadkar from Singapore. Miss Sonal, welcome to the show. Namaste.
Hi.
Hello, thank you for being here. We have Mr. Ashutosh Joshi, all the way from Dubai. Ashutosh.
Hello, everyone.
Namaste.
Namaste.
Thanks for being here. We have Shruti Rajgaria, all the way from Hong Kong. Shruti ji, namaste. Thank you for being here.
Thank you for having me. Thank you.
Great. And we have Miss Savita Tiwari, who is from Mauritius. Savita,
namaste.
Thank you for being here. Namaste.
Thank you.
And we have Mr. Utsa Dubey, all the way from Australia. Utsa ji, thank you for being here today. Namaste.
Namaste. Thank you for having me. Hello, everyone.
Hi. Thank you for being here. And last but not least, we have Mr. Gurvinder Bindra, who is all the way from the USA. Mr. Bindra, thank you for being here. Namaste. Can you hear us, Mr. Bindra? I think he's joining in. So while we wait for him to join in, why don't we do some individual introductions? Why don't you guys tell us a little bit about what you guys do before we get into COVID-19 and the specifics of the discussion? So why don't we open up by saying where you're from, what you do, and perhaps what time is it? Thanks for joining. I know we're across all time zones. It's 3 p.m. for me or 4 p.m. for me right now. But you guys must be waking up in the middle of the night and all sorts of hours going on here. So Miss Sonal, why don't we start with you?
Hi, everyone. I am currently in Singapore. It's 6:30 here in the evening. So not too bad so far.
Not too bad.
Not too bad. I am a learning and development professional. My main role is to consult various organizations in figuring out learning and development needs. I consult them on what exactly is it that not only what they require, but what solutions we can offer them. My last project was with a university. It was a $75 million project on converting everything online. And this was a 4-year project, which we started in 2015. And I don't know whether I should say it was just sheer luck or what, but Nanyang Technology University in Singapore has now completely gone online with over 650 courses, which are completely online, 100%.
I'm sure it was not luck. I think it was all your hard work. So thank you.
Yeah, I suppose I never expected the results of such a big project to come out so quickly and at this scale.
And that's it's. I'm really happy to hear online learning because that's super important, especially during COVID. I know my kids are doing all of their courses online right now, and they're getting used to the new system. So super important. Thank you for that introduction. Why don't we go down the line?
Thanks so much.
Let's go a little out of order, Miss Tiwari. Why don't you introduce yourself? So, where you're from, what time is it, and a little bit about yourself.
Yeah, namaste to everyone. I'm Savita Tiwari. I'm a journalist in Mauritius. And before I tell about myself, मैं मॉरिशस के बारे में जो जितने भी देखने वाले हैं, जितने भी स्पीकर्स हैं हमारे और जितने भी हमारे व्यूअर्स हैं, उनको मैं मॉरिशस के बारे में थोड़ी सी जानकारी देना चाहूँगी कि एक आइलैंड नेशन है और जो इंडिया के साउथ वेस्ट कॉर्नर में आता है. एंड इट्स अ वेरी स्मॉल आइलैंड. 2040 किलोमीटर स्क्वायर का ये आइलैंड है. अराउंड हम नॉर्थ से साउथ जाते हैं तो इट्स 70 किलोमीटर्स एंड ईस्ट पॉइंट टू वेस्ट पॉइंट जाते हैं तो इट्स लाइक 55 किलोमीटर. सो स्मॉल. सो और अभी यहाँ दोपहर हो रही है. इट्स 2:30 एंड विंटर्स हमारे यहाँ शुरू हो गए हैं. इट्स लाइक विंटर्स हैव स्टार्टेड. और कोविड की मैं बाद में बताऊंगी. आई एम अ जर्नलिस्ट एंड आई राइट अबाउट द नेशन, आइलैंड नेशन, in all the magazines around India, UK and USA. And for Mauritius, I'm writing for a newspaper called Defi Media. So that's my introduction, small.
Awesome. Thank you. How about Ms. Shruti? Why don't you go next?
Hi, so I'm in Hong Kong. And in fact, we just moved last year from Singapore. We stayed in Singapore for a while and then we moved to Hong Kong. I'm a professor of law, but here I'm teaching English. And my previous project was with the UN, with the government of India, but now I'm doing something completely different here. And it's 6:36 here in the evening, so not bad. It's a good way to end the day. And the summer's coming in, so we're looking forward to the sun, hopefully.
Great. Thank you so much for being here.
Thank you.
Mr. Ashutosh, how about you?
Yeah, hello everyone. This is Ashutosh from UAE. I have been to different cities also, but currently I'm in Dubai. I have been to Singapore and Sydney also. But currently I'm working in an IT distribution firm. So it's been, I think, 1.5 years, almost 2 years now. So now it's chill out summer. It's very hot here right now. It's almost 40 degrees. So you can consider that it's a very different time zone as well as different weather conditions also. So thank you for this opportunity to share my views and get at least it's a good platform to share what is the best practices as being followed in different corner of the world. So I think about COVID-19 we will discuss later on. It's about
Yes.
Just intro, so it's fine for me this side.
Thanks so much for being here. Mr. Dubey,
Thank you.
and then we'll go to Mr. Bindra.
Sure. Hello, everyone. My name is Utsa. I'm a mechanical engineer by profession, and I've been in Australia from last 10 years now, and mostly working in the mining sector, because that's the core of Australia. And time zone wise, it's almost, we share the same time zone as Singapore. So it's like 6:38 here. And weather wise, it will be, unfortunately, the flu season coming up in Australia.
Oh, gosh.
So yeah, fingers crossed.
Thank you so much for being here, Mr. Dubey. Really appreciate it.
Pleasure.
Professor Bindra, welcome. Namaste.
Professor?
Sorry,
इतनी पढ़ाई अभी तक नहीं की मैंने.
My bad. I just read the word. I think I was looking at Ms. Shruti's profile. She's just mentioned that she was a professor. Mr. Bindra, sorry for that. Welcome to the show. Thank you for joining in. I hope it wasn't much trouble.
It's only 3 o'clock at night.
Okay, great.
But it's definitely an interesting topic. I actually almost had to cancel due to a family emergency. Fortunately, that tided over.
Okay.
I've basically been a ex-sailor who's now a techie, working in the IT industry. Been in the US now for almost like 12 years. And it's interesting to see a complete global view of what's going on, which seems to be affecting each one of us individually, but you realize now everybody's in it, and this is truly everybody in it globally.
Great. And just out of curiosity, where in the USA are you based?
Los Angeles.
Los Angeles. Oh, I went to USC. Great.
Oh, okay.
Awesome.
Wife works for UCLA, so she's a competitor.
There you go. Fight on. All right, so let's get started with our COVID discussion. I think a lot of people are really. I was super interested in this topic, and I'm so glad that all of you could make it once again. Just because it's very interesting to see how each country is tackling COVID and what you all as working professionals are doing to kind of tackle it yourselves, and sort of the struggles you're facing as well as what you're doing to deal with it. So let's start with, I think, the Singapore. That's what I'd like to open up with, because Singapore actually had a very interesting case. Now, when the SARS epidemic had hit, Singapore was really, really hit hard. And it seemed that, when COVID hit, they were very, very well prepared in terms of preparedness and response. It didn't seem like they would have to go into a lockdown. I have a nephew over there and family members over there, and they were saying, no, we don't have any lockdown. We're going to play tennis, as India was in its national lockdown. So now I think the situation has changed. So would you like to address that? Can you tell us a little bit about what's going on in the ground situation and how the situation has changed? Has it impacted communities? Has it impacted you?
Singapore was a very, very unique case, I would say. Apart from Shruti, who's in Hong Kong, I think Singapore was the second country to basically start shutting its borders as
Correct.
far back as January. So I think in the day the WHO declared this to be an epidemic, not a pandemic, but an epidemic, Singapore shut borders to almost 8 countries at the same time in Asia. So China, Hong Kong, Taiwan, Japan, and the likes. And the minute that happened, I think a lot of the first influx, almost entirely stopped, which was also the reason why throughout the month of February, right up till maybe the first week of April, Singapore had just one standard trend of single digit number, maybe maximum in their 20s, but mostly single digit rises every day. And the government kept informing us through what we have is a national level WhatsApp message that comes in twice a day that to give us. So right up till first week of April, keeping the border shut to ASEAN and Asia at large, including India from, I think, end of first week of March, they just shut borders. So that kept the whole thing under control. To be very, very fair and honest here, I think what they did not expect is the lack of response in the West.
Okay.
Absolute and complete lack of response in Europe, UK, and US.
That's a very interesting point, and sorry to cut you off, but that's just what I wanted to get to, because now, Mr. Bindra, the situation in the US is probably the worst in terms of how things are getting, in terms of figures and in terms of reported statistics. Can you talk a little bit about how it's escalated, maybe perhaps not LA figures or exact figures, but what the situation is like? I mean, at least you might say there are so many cases.
Well, when you look at the scenario, there's a whole bunch of things to address here. Is my audio clear?
Yes.
Yes.
Okay. There's a whole bunch of things to address out here, and most importantly, you have to understand that in a political level, like India, unfortunately, US is also quite segmented. So this entire thing becomes a battle of the the Republicans versus Democrats. That's one part of it.
And you have an election coming up as well. That's hopefully
as
not.
Well, yeah. So that actually throws up a lot in the air. But that's just one one cog in the wheel, as they say. You also have to consider the fact that America's biggest investor in the world is China.
Right.
It also means that the influx of Chinese population in the US is in places that are extremely rural, in fact. The US has been running a green card EB-5 visa, where it actually encourages people, okay, you have $500,000, come in, but we'll tell you where you have to go and settle down, and Chinese have been settling down those places too. And these places have had a major travel communication, people leaving China, coming back to China on a regular basis. So that's been another, input point, as you want to call it, right?
Correct.
And the third was Mr. Trump himself, in the sense that this economy has been his biggest selling point, on which he was basically running his election campaign. And shutting down the economy was definitely not something he was going to be very, comfortable with.
Correct.
So, I mean, it does boil down to politics, but these two major points, and the third point, which is also again politics, is the fact that we found that a lot of the healthcare mechanism was definitely not ready to take care of the people at such a large level as such.
No, I was just talking to another friend in LA, just out of curiosity, just in terms of the, it's not a complete lockdown. She was saying we can still go out for jogs. We maintain, people are very earnest that way. They are maintaining social distancing in grocery stores when they're going to parks for jogging or whatever it may be. There you go. We all have one of those at this point.
Exactly.
Is the ground situation, it's very interesting because the PM came out in his Mann Ki Baat address today. And he said that, it's not just the government that fights it, it's the people that fight it. So I believe the people are being very, very earnest, not just in the USA, obviously in every country. But it's a fact. I mean, even if the PM gives an order or the president gives an order to not go to a grocery store, it's up to us to not go to that grocery store to maintain social distancing. So can you see people following the rules by and large where you are?
Have you been to LA?
I lived there for some time.
I live in El Segundo, right next to LAX.
There you go.
I can get down to downtown in less than 20 minutes.
Oh, wow. Okay, so for the record, traffic in LA is horrendous. That route would likely take, it's worse than in India.
Hour and a half, easy.
So that route will easily take an hour and a half. So that's awesome. Thank you for that. Now let's go to Hong Kong. Shruti, I think that Hong Kong was one of the only countries in the world that didn't go into a complete lockdown. One of the countries, I should say, that was impacted by COVID-19 that has yet not gone into a national lockdown. Can you describe the situation over there?
So it started off for us in the first week of Jan. That's where we saw certain impacts of COVID. And I think because this country has had such a detrimental effect, sort of during the SARS, the people got extremely, extremely worried here. So in terms of masks, in terms of hand sanitizers, in terms of the cleanliness, all of the equipment that's required, people started hoarding it. So towards the end of Jan, we had no masks, we had no hand sanitizers available. We did not have toilet paper. So there was this full 1 week where the country was like, we don't have toilet paper. And it was a mess basically till the end of Jan. But the good thing that the government did was that they immediately shut down the public places, and especially schools and colleges. So that worked out in our favor quite a bit, because about 35%, around the 35% of students come from China. So we needed to block that and stop that out first.
Correct.
And also the government offices went, they were all working from home. But the private companies were told that you need to decide how is it that you would like to sort of like operate. So they called in the essential staff, whereas the non-essential staff stayed at home. So by mid of Feb, it was quite contained. We had contained it quite a bit, and we had a bit of a structure where if you needed to go into a mall, if you needed to go into a restaurant, or even just into a pharmacy, you cannot enter if you don't have a mask. You have to have a mask. And the government and a lot of private citizens came out and they were distributing masks for free. So the entire community, everyone came together. So we're not on a lockdown at all actually right now. But the government has said till about the 7th of May, all public places will run at 50% the capacity. And they do a patrolling every hour, I believe. And you have a fine, and you can also be taken to prison if you're not working at half the capacity. So if a restaurant can seat maybe 10 people, only 5 people can be seated, and you cannot wait outside to go in. That's not allowed. So I feel like it's the people who are really, really taking care in terms of masks, in terms of hand sanitizers, which is making it easy for us to go out maybe once a day. And because the government isn't imposing a complete lockdown, the citizens are being very responsible about this.
Great.
Another interesting thing that happened a few days ago that the news came out about, that there's a very big hotel in the Kowloon side of Hong Kong, which has been transformed into a temporary safe house for people who are landing into Hong Kong. And the government is providing for them, so they're taken straight there, and they're given a deep swab test. And I think the results come out within 24 hours. And if they're clear to go home, then they can go home and be sort of quarantined for 14 days at home, which I think is fantastic.
That is fantastic. And that's so positive to hear. Thank you for that. Miss Tiwari, if you can talk a little bit about Mauritius, because to be quite honest, that's not a country that's in the news very often, and you're a journalist. So can we, I think perhaps the most that a person on the street, at least in India, would know is that India is sending medicine to Mauritius.
Yes, India.
Can you talk a little bit about, number one, the COVID situation, and what are the main essentials? Perhaps as a journalist, you can speak about this. Are the medicines helping people? What's going on?
फर्स्ट ऑफ ऑल कोविड की इंफॉर्मेशन दूं उससे पहले मैं इंडियन गवर्नमेंट को मॉरिशस की तरफ से थैंक यू बोलना चाहती हूँ. दे हैव सेंट 1 मिलियन हाइड्रोक्सीक्लोरोक्विन टैबलेट्स टू मॉरिशस एंड इट इज वेरी क्रूशियल इन दिस टाइम. और मॉरिशस में 331 केसेस आए थे और पॉपुलेशन इट्स वेरी लाइक 12 lakh 1.2 million people in Mauritius. So 331 cases was like too much for us, because अगर ये third stage में फैल जाता तो Mauritius is a small country and people are very close to each other. It's a small place, so ये बहुत ज़्यादा बढ़ जाता. But government ने 18th March को first case आया कोविड का, and 20th March the government decided to do a lockdown, complete lockdown, and it was very strict. Only the pharmacies were open, and not even the supermarkets they all were closed. And within 1 month, and today we have only 24 active cases, though we have 9 deaths and 300 people have recovered. But the thing is, it's like government has taken very strict actions. एकदम शुरू में जैसे 3-4 cases आए, गवर्नमेंट ने कंप्लीट लॉकडाउन कर दिया. एंड इट वाज नॉट लाइक कि सिर्फ प्राइम मिनिस्टर एंड हेल्थ मिनिस्टर वाज एक्टिव, द एग्रीकल्चर मिनिस्टर वाज एक्टिव, क्योंकि इंडिया मॉरिशस में जो कुछ आता है वो बाहर की कंट्रीज से आता है. एवरीथिंग इज ऑफ इम्पोर्ट. द फूड ग्रेन्स, द वेजिटेबल्स, एवरीथिंग कम्स फ्रॉम आउटसाइड. सो द एग्रीकल्चर मिनिस्टर ने मीटिंग की दैट वी हैव टू प्रोड्यूस आवर ओन फूड ड्यूरिंग दिस टाइम. So जितने भी स्टेक होल्डर्स थे उनसे मीटिंग करी, एंड अटॉर्नी जनरल ही डिड द मीटिंग ओनली ऑन द 20th, जिस दिन लॉकडाउन हुआ उसी दिन, कि वी हैव टू ड्राफ्ट अ COVID-19 bill that how we are going to survive after this. So these were very small things the government took control of. So today we are only in 24 cases, and the youngest death was of 20-year-old girl, जिसके पूरी फैमिली को infection हो गया था. Everybody was quarantined, so the authorities had to do the funeral, and the eldest person was a business tycoon of Mauritius, the level of Tata and Birlas in India. He was a business tycoon of Mauritius, the Carl Tech, and he died of COVID-19. And the one thing that I really wanted to point out is how they are taking care of healthcare workers in Mauritius. जितने भी हेल्थ केयर वर्कर्स हैं उन्हें यहाँ एक स्पेसिफिक कोविड के लिए स्पेसिफिक हॉस्पिटल बनाया गया है. जितने भी पेशेंट्स हैं उन्हें वहीं रखा जाता है, और जो हेल्थ केयर वर्कर्स हैं, जितने भी डॉक्टर्स हैं, नर्सेज हैं, उन्हें वहाँ उनको अगर उनकी ड्यूटी लगाई गई है तो उन्हें दे आर नॉट अलाउड टू गो होम फॉर द नेक्स्ट 14 days. They have to work there, and they are shifted into the hotel rooms. And then after 14 days, the new staff will come. and they asked.
That is what I had heard as well. So, एक question है, पूरा lockdown है citizens के लिए, because it seems by and large excellent measures have been taken to get it back under control.
It was like complete lockdown for the initial 14 days. Then the supermarkets and the small shops, grocery shops were opened. And because Indians, chai बहुत जरूरी होती है Indians के लिए morning में. So the milk was like Indians population.
Not just in the morning, anytime.
Yeah, anytime. Yeah. So they were like the Tetra packs of milk was Indians को सबसे ज़्यादा problem थी कि we are not getting the milk and we really need the chai of the morning chai at least we need. So Indians तो Tetra pack milk लेने ही गए थे.
उधर lockdown है या नहीं?
Yeah, it's like it's extended for full day. Yeah, it's extended to 4th May. Yeah.
Okay. Let me go to Mr. Joshi, and thank you so much, Mr. Dubey and Mr. Joshi. You guys have been very patient listening to all of this. But let me go to Mr. Joshi in Dubai, because Dubai is, I have a very specific question about Australia. So before we get there, Dubai is also a country that's not so much in the news. So can you tell us a little bit about the situation there and what's going on in Dubai?
From last 1 month, it was the complete lockdown. Earlier, it was partial lockdown, means on specific time it was allowed to go. And apart from the time, there was some sterilization process all across the UAE. And from today onwards, they have, even it's a holy time for Ramadan now. So they have opened, they have again partially opened it, and now 6 a.m. to 10 p.m. it's allowed to go. Apart from that, the sterilization process is taken care of. But if we look at the figures, currently the reported cases are 9,000, and 70. Approximate 70 deaths are reported, and 1,800 to I think 1,900 cases are recovered. But looking to the measures, they are because they are also working to improve the cases. They are going with the technology, whatever they have, they are using it, utilizing it, and earlier before that, I should say the lockdown period, it was very strict. Like everybody said, that mask is compulsory. So apart from mask, there were gloves are also mandatory. If you want to go to the grocery shopping and anywhere, they will not allow you and let you in if you don't have mask and gloves.
Oh, wow. Okay. That's strict.
And one more example of partial lockdown, when it was not allowed, they have imposed one system, portal system, in which you can apply that, okay, you have some emergency, you have something to buy, grocery for, otherwise you are going for pharmacy. So you can apply on that portal, and limited slot will be allotted to you. And if you got the permit, then you can go on. And it happened, one of my friend was out, and police caught him, and police asked him that you are going, okay, you have mask, okay, you have gloves, but why are you going at this time? So he told, I applied for the permit, and this is my permit. So then they told, okay, it's fine. So they're very strict with the rules and regulation.
Great.
And apart from the technology, they are also come up with the smart helmets. So like in movies and movies, what we have seen, that some screen and in which it was a thermal filter will be there. And so in which they can see that what is the temperature of the person. I have that video also, if I can share, let me try.
We can put the video links out just to save, because there's so many people on the panel. I want to get to everyone more than once, but we'll definitely share that video with me. We'll share it with the post. But what what's the situation now? It was a partial lockdown. Now is it a full lockdown, or because 9,000 is quite a lot?
Yeah. Now it is open. Public transport is open from today, but the measures are strict, that you have to follow the rules. Means you have to wear the mask. You have to, if it is not necessary, don't go out. And even the companies and will work with a 30% workforce, rotating staff.
Now you're a student, right? If I'm not mistaken, you've done your MBA. What
I
what
have
is the
completed my
situation?
MBA.
You've completed
Right
your
now I'm doing job. Yeah. Right now I'm in
Okay,
job.
congratulations. But what is the situation in schools like now that public transportation is open? And yes, they say that if it's not necessary, do not go out. Here in India, public transportation is completely shut across the country. But it's really hard to make that choice, right? Especially if you're a student or doing your MBA or doing your postgrad. It's very hard to make that decision. Should I go? Should I not go? Should I go? Should I not go? So how are people
Yeah.
making that decision? I mean, do you have current students that you could speak on behalf of, or even going to work? How do you make that decision of is it necessary to go, is it not? That's a very individual decision.
Like due to some technological advancement, most of the works can be done remotely.
Okay.
So we are thankful to the technology that we are able to do it. So this is the thing, and students can also join online sessions. So they are doing it.
Great.
So many of the physical activity, which is really important, that can be done with the approval and all with the permits system.
Okay. Okay.
Like
So it
Zomato
seems like very
deliveries
well
are on
policed.
here.
It seems that you will get caught if you try to do something out of line over there in Dubai.
Yeah. But it's
Great.
good actually if you will be in the line, so it is beneficial for everyone.
Great. And last but not least, we have Mr. Dubey. Thank you so much for being so patient. But there are a lot of, now you are based in Australia. Where in Australia are you based?
I'm based in Perth, in WA, Western
In
Australia.
Perth. Okay. So what is, I mean, I've been reading a lot of articles, especially in Australia, that a lot of cases are actually coming from cruise ships. So can you talk a little bit about the situation there?
Yes, definitely. That was the only, maybe I would say, not a mistake, but only slip that Australia, like it happened in Australia, because it was that Diamond Princess cruise ship which came, and that started this whole thing because they missed to check all the temperatures and whatnot. And they sealed all the international borders and everything, but they were not able to manage the ship properly. And that's when everything started in Australia. It was like late January, early February.
Was that true? That I mean, they were saying 20. I mean, was that an exaggeration by media, or they were saying 20% of Australia's, or that entire continent, Australia's cases came from that cruise ship?
Yes, that's true. Because till now, it's like they have almost got 6,700 total infections. Out of that, I think 5,000 something have been cured, and there are only 83 deaths. And out of that 83 deaths, I would say 90% were from that cruise ship, people who were from the cruise ship.
Oh, okay. Wow. All right.
So there was no community spread. But as soon as they found this first case, I would say the government, they acted so quick and so in a proper way. So there was never a complete lockdown in Australia, nowhere. The only thing that was like public transport, everything was going on, all the shops were open. They just asked people to follow the social distancing laws, and people were following them. And they asked people that, look, there's something outside. If you want to go and get it, you can get it. But for your sake, it's better to stay at home. So they didn't say that you will be fined or anything. But then what happened the first day when they did this lockdown, as in everywhere in the world, there were few people who started doing party at the beach. And then the government said, all right, so that's not happening because this will not be happening like that. So then they said, okay, on the spot, $1,000 fine. So you have to follow the rule. You can move in your family. If you want to do picnic outside, you want to go to beach, go, but you have to be with your family members. That's all. And you should not be more than 10 people. So if you're saying I'm a family of 20 people, you can only sit in a group of 10. So
they can choose wisely.
So they never locked down, but the good thing that the government did, like as soon as they start, the only thing that they blocked were the restaurants, the pubs, and these places where you have large gatherings. But when the Prime Minister announced that, with that, he announced the stimulus package. Because what happens, like in any part of the world, when you say lockdown, the first people, that's like small business owners, the people who do day-to-day work, who are working on a contract basis, who get paid daily, they are the first one who gets into panic. And those are the people who will be going out in the society or trying to do something. So as soon as they announced the lockdown, like this partial sort of lockdown, where people If you don't need them, don't ask them to come to work.
Okay.
Straight away, they said the employers that you don't throw out your employees, just keep them on your roll,
Right.
and the government will pay you $1,500 fortnightly for them, for keeping them on your payroll. Because it was win-win for both of them. First, the people will get money. And the second thing for the employers, he said that, look, this will over. This will over. This will go for
Right.
month, 2 months, 6 months, whatever. It will over. But after that, when you want to bring back the economy on track, you will not find your workers. You will not find your trained people because they will be going somewhere. They have to earn. So you will
Correct.
lose them. And then it will take too much time. And maybe you might lose your business, like you will be gone forever. But because you know that, yes, government is helping you now and you have got your employees already there. And the second thing is with the tenants, because you know all these hotels, they are mostly in a places where they are paying rents to the landlords. So
Yep.
basically, then they said, okay, between tenants and landlords, you come to an agreement that, look, I can't pay you now. The landlords say, okay, I will not throw you out. Both of them go to the bank and say, look, we can't pay you for 6 months. So just defer our loans or defer our mortgage for 6 months, whatever. So these were a few small little things which the government took care of like at very early stage, before even the panic set in or anyone was thinking what will happen to us or whatever.
Right.
And the other thing, they with the schools, that was like highly criticized in Australia, that they were not stopping the schools. They were not closing the schools, and they didn't close. Like the first term ended on last day of March, and my kid still his school was open, and that was everyone was criticizing that why you're not closing it. And the Prime Minister, he said two things. First thing, if you stop sending kids to the school, they will stay at home. And there's so many parents who are healthcare workers in police and all these different areas. They have to stay home to take care of their kids.
Yep.
If not, they will be sending the kids to their grandparents who are more vulnerable.
Correct.
So, I mean, they really took very smart decisions. And I would say it is, I mean, I'm lucky to stay in this country at the moment because it's really very safe. Like from last 1 week, they didn't have any cases. It's just 0 cases. And as I said, that out of 6,000 something, 5,000 already cured. And they're starting to reopening, like starting to do the relaxations more. And they have already started, they've decided to start the schools from next term. That is like from next
Great.
week, next Wednesday.
And that's interesting that you are, thank you for that. That's it. I mean, it seems very relaxed over there compared to India at the moment. So
Yeah,
but going
definitely.
to especially schools, this is a very important thing. Mr. Bindra, I think schools in the United States, I've read that schools in New York, that's a big hotspot. They are closed until September. Universities, a lot of them, like all my schools that I went to, I think all of them, Harvard and USC, Illinois, they are all starting and very much preparing for online learning. And Sonal, perhaps maybe after Mr. Bindra, you'd want to talk a little bit about this. But do you see, what is the impact of this? Because I mean, part of the magic, especially for a student, is to go on campus and experience it. But now there's no choice. Is the situation really that bad across the country? Can you see our schools shutting down across the country, or is it just in those hotspots and containment areas, like zones like New York City?
No, I'm quite surprised at what Mr. Dubey just said. I wish somebody had thought of it over here. It's precisely what's happening in India right now. Our schools are completely shut down. There is talk that the schools will not even open till December, like, you know, right,
Okay.
to go straight into 2021. The positives, if you want to look at it that way, is that at a very young age, the kids are getting used to, you know, getting into self-discipline of getting up and getting, you know, being there at the classes and all that stuff. And my youngest kid is just 5 years old, and he's also on his Kindle, and he's on his Zoom lessons with his teacher and stuff like that.
Yep.
I mean, like 2 years back, it is something that only office goers did. Now it is like everybody's doing it, right?
Yeah.
Yes, and this is actually this has caught a lot of people's fancy right now, because I mean, being aware of the demographics of the US, right? Again, it's the same situation that the Democratic states are doing this very well. The Republican states are not following it too well. Even shutdowns is very prominent in Democratic states, is not that prominent in Republican. And
Okay.
then again, the infections also, you will see majority are democratic states where the infections are the maximum.
So how do you feel this will impact the, number one, these are loaded questions, but how do you feel that, I'm just asking because the elections are so close right now. The US presidential elections are in November. If they're not going to get delayed, it looks like it is going to be Biden versus Trump at the moment. How do you
There's no
feel
other
it,
option.
how do you feel the discourse? Is the discourse changing? Because as you said, economy was something that Trump always delivered on in terms of that was his strong point. That was his campaign strategy. Do you feel that perhaps now things are changing? The discourse is changing because of the way it's being handled there?
No, people are too focused on what's going on with their own life right now.
Okay.
I don't think anybody's got the chance to sit back and analyze as to how this will impact their politics as yet.
Okay. All right. Great. And that was a very honest answer. Thank you. So going into that, let's maybe talk, maybe Ashutosh, since you just finished your MBA, and Ms. Sonal, since you, did a huge project on e-learning, is this the way forward? Because I think, as Mr. Bindra said, it's not just going to end. Life is not going to suddenly get back to normal just because the lockdowns are relaxed, right? And the lockdowns are going to end. It's going to be a slow sort of get back into normalcy, and it's going to actually, I think we're changing the definition of what we thought as normal. As Mr. Bindra pointed out, now everybody is using technology, including his 5-year-old, right? Which is super
Well,
true.
I have one important point to add to the importance part of it.
Yeah.
It is almost unheard of that students are not able to attend their graduations and not able to attend their proms. And that is causing a major morale loss in this entire country. Especially
and
the
just for the
youngsters.
record, prom is a huge deal. I remember, just I went all the way to India, designed a prom dress, got it back with special, like in my hand on the flight, and then went to my prom. So it's a huge deal in the United States.
So I think what happened majorly with Singapore was that, just like Australia, right up to 24th of March, schools weren't shut here. Schools, colleges, nothing.
Okay.
They were still on.
That's fairly
yeah, and one of the cases that we just don't consider is that maybe children are not getting as badly affected by the COVID virus. But
when you say children,
are
sorry to
carriers.
interrupt. When you say children, do you mean elementary school? Do you mean all students?
So I'm right now talking more about school, because Singapore is running a very, very interesting experiment here right now. I'll just get to that in a minute.
Yeah.
But what we don't realize is that children are carriers. A lot of them are asymptomatic carriers, which is something that kind of led to the community spread in Singapore. I'm not completely sure how much they will come to it in the sense of acceptance. But we saw a spike in community cases with school employees, for example. Right. And the reason for that was most of these children's parents had just either were travelers. Singapore is a country where local business is quite small, and majority of the people travel all the time in Asia.
Correct.
So a lot of these people's parents had come back from the different countries, and they were carriers. So we had 3 or 4 schools where clusters were formed within the administration. Same thing happened with local as well as international schools. So not shutting schools did not turn out to be one of the best moves, although the reasons for not shutting them were the same. A lot of aging population, parents were still going to work. Where do you leave children if they're not going to school, right?
Yep.
So what they are running right now is that all schools in Singapore, whether it's international or government run, have e-learning programs or online classes happening. It is also possible because in Singapore, the local schools also, the number of students per class is limited to about 30 to 35.
Okay.
So essentially, you're not overcrowding even the Zoom sessions in that sense.
Right.
As far as universities are concerned, they completed their semester online. All the universities completed their semesters online because in Singapore, universities, the second semester of the year falls from January to May.
Okay.
So, or third, depending upon which is, but it usually ends in May, which means that they will all graduate. They will all finish the exams now and graduate. As far as the exams are concerned, whatever I have heard so far, exams have been cancelled until next notice, which my hunch is that they will delay the exams to June.
Correct.
That's when they are expecting the opening of whatever lockdown you can call it. Technically, it's still not a lockdown because all our services are still working, but people are not allowed to walk in twos anymore, even if it's your own family.
There are restrictions in place.
Yeah, so they're all education systems right now are on complete e-learning mode here for the entire country.
Okay.
How much of the success will e-learning create for schools is yet to be seen. Exams have been cancelled as far as I know. So no exams for schools.
Okay.
This year, they will all be promoted to next year.
Great.
As far as university is concerned, I guess the exams are just postponed for now.
And that's interesting. This is a very interesting experiment. And I was hoping that you would bring it up because I was reading a little bit about it. And, perhaps Ashutosh and Shruti, if you want to maybe give your perspectives on it, number one, as a professor, and number two, as a student. Is this going to be the way forward? Now, you already completed your MBA. My last degree, I was 2018. So by and large, I had a very traditional graduation ceremony, and the courses were all, sort of in the classrooms and on campus. Do you see this scenario, this milieu changing, or do you feel that it's just going to be temporary, then life back to normal? Because it does play, the thing about it, as Mr. Bindra pointed out, it's not just small children that are getting affected by it or high school students that are getting affected by it. It is students, I would say, of all ages, whether you're doing your post-graduation or just going to elementary school. You are changing so quickly in terms of your ways of learning, and you're adapting so quickly to new methods of learning, which is e-learning by and large. Do you see this being the future? Is more e-learning going to anyways be incorporated in the long term, even after we get out of this world of COVID and enter perhaps a new normal? Shruti, why don't you talk to us maybe a little bit as a professor, and then Ashutosh maybe as a recent graduate?
So one of the things that Hong Kong sort of decided to go ahead with was the HKDSE exams, which is their board exams. And there was a lot of chatter about whether they should be organizing these sort of exams at all. But the government came out and said that, unlike a lot of other countries across the globe, this is the only sort of threshold we have in order to determine if our students are capable to going to the next level or not. And they said that if we don't hold these board exams, our entire year, the entire 2020 year, is sort of going to get wasted. So just on the 24th, which is Friday, they took about 10 days sort of before that, and they got all schools equipped in order to give the exam. And they came out and they said that there's a difference between taking an exam and there's a difference between going to class, because in class, there's a lot of interaction between and among students, as well as students and teachers. But for an exam, if you're able to maintain a lot of distance and you're able to keep the social sort of distancing rules in place, you're able to do. So they were able to organize these exams. Talking about the new normal, the one thing that I've come to realize at the end of this, at the end of the last 4 months that we've had, is that even though it's not sort of ideal, we can, education can be imparted online. It's not that you need to be physically present. It's great if you can be, but I think that once the world sort of like emerges from this, I would sort of like to believe that maybe 45 to 50% would go online, because we've been doing a lot of classes online for primary students from 6 to 12, and they're doing a fantastic job. At being able to sort of be on point for their sort of classes. And even when 6 months before, when they were sort of hiring teachers, one of the main components was that if the teacher is able to incorporate technology into the way she teaches. So the emphasis on technology is extremely strong. So I do think that it will become the new normal. I think it will.
That's okay. Interesting. What, Ashutosh, how about you? Because especially in grad school programs, a big part of going to a grad school is definitely networking with the professors. And you can't get that same networking without being there in person. So do you see more
Definitely.
technology being incorporated? Do you see it being completely online, partially online, as Shruti was saying, 40–50% online? Is that going to impact your experience in a degree program?
Absolutely. Actually, even for me, it's 1.5 year past when I completed my MBA. So actually, now most of the things are database. Even the professor, faculties, even students, what they are dealing is mostly on data. You are accessing on your computer only. It's a PPT, it's Excel, Word, anything. So even the exams, what you are giving, even what exams I have given, hardly I have used pen or paper. I mostly give all the exams. Most of the exams were on my computer only, and there was some specific software which not let you allow to use any other software, so that it's very ethical. That it's an exam, you cannot copy and you cannot use the internet to copy paste or anything. So it's the new era of
Right.
education, that uh, what we used to think and earlier, that okay, pen paper is the essential thing. Now it's you need internet connection, you need iPad, laptop, anything. That's
Yep.
it. Even I have an experience. My friend has some kindergarten children. So during this time, because it's a kindergarten school, they have started it, and what they are doing it, the sessions are going on iPad, but rest of the things, it's a parent's responsibility to manage that the children are going through the lessons or not.
Okay.
So
Interesting. So it is going to be a new era then. And Miss Tiwari, I
absolutely.
want to talk to you because you are a journalist. Now there's a lot of talk of really quickly, because I want everyone to have final thoughts before I get there. I just want to, in the field of journalism, right? Do you see post-COVID era or the new normal, do you see journalism also getting more digital? Do you see the profession changing?
Yes, like nowadays, everybody is not going for a bite to the person. They are doing the video conferencing with everyone.
Yep.
Like myself, I'm into print media, I'm not into the TV media. So it was like not a major problem for me, because it's normal to talk on a phone, take their views and
Correct.
write it down and send it to the editor by mail. So it was like completely normal for me. But for the TV people, it's going to be hard, because they personally they have to do something like they get many things which they edit during the editing thing. But when they are doing the live session, they have to show each and everything what the person is saying. There is a very less scope when they are doing live. But now, like, every news channel is doing live video conferencing through the digital.
Correct. And
So
I think one of the biggest things that, especially that we've seen during COVID and in recent times, no matter what country we're from, I think this is something that is common, unfortunately, in all the countries that are representative here, as well as the countries that are not. A lot of misinformation and fake news. So can you perhaps tell the audience who's watching the importance of looking to credible sources, no matter what country you're from?
see this session, we are so many peoples here. If this session would be done by a live session, they would have edited it into a 15 minutes thing, what people have said, small part, not the whole thing what we all have said right now. So they would have edited it into 15 minutes. Like, now they have to show each and everything what everybody's sharing. Like, we have very little scope of editing here in this right now, when we are
Correct.
doing live things and all. So eventually everything will be coming back to normal. Like, people are saying that 50% will go digital. No, I don't think that is going to happen,
Okay.
because
Interesting.
live thing, people connecting with each other, it's very important in education. Like in Mauritius, when the schools were closed, it was already closed before 1 week, because we have cyclonic season here. So it wasn't an issue like we have to shut down the schools immediately. The schools were already closed for 1 week due to cyclones. So now they are doing, the one thing that is very interesting in Mauritius is all schools have the same syllabus. So the teacher comes on TV every day. That's the live program. They teach grade 1, grade 2, grade 3 for 1 hour each classes. So due to the syllabus is all the same in all the schools of Mauritius, it's very easy like that.
Okay.
Instead of Zoom, they are teaching on
Great.
TV. There is a separate channel for education. The whole day, all the grades are being taught for 1 hour. So that's happening in Mauritius.
Awesome.
And I think when everything will be like normal, the students would like to go to school. They don't want to do it online because the connection, human connection, the friends connection, it's very important for the human being, I think.
Correct. And by new normal, I don't mean, I want to get everyone's last thoughts because we have just a few minutes here. But I don't mean, that we're just going to be in our homes forever. Of course, we're going to go out eventually. And I hope that's sooner than later. But there are definitely, as pointed out by everyone in this discussion group, there are going to be some very significant changes, some very significant adaptations that are going to impact individual and the country as a whole, the continent as a whole, the world as a whole.
The Mauritius economy, 25% GDP depends on tourism, and there are not a single tourist right
tourism.
now.
So
everything is going to change after the post-COVID era. It's going to
Correct.
change. 5% GDP is like crashed. So how we are going
Correct.
to survive? Obviously, we have to adapt to new things.
Yeah, and tourism industry is one of the biggest that's being hit all over the world as well. So as I was saying, everyone has to kind of adapt to this new sense of normalcy. Now, I just want to go around. Perhaps we can start with Mr. Dubey all the way from Australia. I just want to end the show and end this session with maybe some final thoughts on a positive note. You guys are representing your country, your continent by being here. Would you just give some maybe positive words of how you're dealing with it, or just a simple "don't worry, we're going to get out of it"? But just leave us on a positive note on behalf of your country or your continent.
Definitely. I mean, as I said, that we are pretty much relaxed from the other part of the world, but still, like, I'm still working from home from last 1 month. And the best thing that we have got out of this, like, I have spent so much time with my little one who is just 4-year-old, because I have spent so much time with him. I'm talking to my parents on Skype and WhatsApp who are in India, and we are spending so much time with each other because now we have got time. They are at home. They are not doing anything. Right. That's the best way. Like, this will pass. This will pass. This will pass. Everything has passed. Like, this earth has got anything and everything, and we've passed it. So we will recover. But this time, the best pass. Is like, yes, it's your personal time. Use it. Do whatever you want to do. Just take up a hobby. Do it.
Great. Thank you for that. Mr. Bindra, thank you so much for being here. I know that it's close to 4 a.m. Thank you for your patience and insight. But would you leave us on a positive note, please? Last thoughts.
Just a way to get your vision together. Remember, every 20 years, something of a global nature happens. So if you want to go 20 years back was 9/11. Before that was the HIV epidemic. So every 20 years, something like this happens. It's just, it's just a, what I say, call this as nature's reset button. Get back in life. Yes. Learn back from whatever mistakes we made in the last 20 years. Make sure we may have a new set of mistakes in the next 20 years. But enjoy yourselves. If something unfortunate happens, you have to just let it go to God. This is where God is the ultimate source of strength that you can get.
Great.
I have a question. That's fine.
Savita, why don't you give your last thoughts?
Yeah, I have one question with Mr. Bindra. Like, the whole media is criticizing Donald Trump. What the Americans thinks about Donald Trump? I want to know if he can answer that.
Let's put it very simply. You've got Modi Bhaiya in India, and you've got Donald Trump in the US. It's absolute apples to apples.
Thank you. That was a great answer.
In Mauritius, people are like missing the sea. Mauritius में किसी का बर्थडे होता है, so we go to the sea. गंगा स्नान होता है, we go to the sea. कुछ किसी की death हो जाती है, so they go to the sea to do all the rituals. So sea is the very part of our life. So I want everything to calm down and we can go back to the sea. That's what we are waiting for. And as for Mauritius, the जो सड़कें हैं यहाँ ये सुनी है, but खेत they are crowded, people are working on the fields, and it is so Like we are going back to basics. सब खेती कर रहे हैं यहाँ पर. जो जिनकी jobs चली गई हैं, seriously they have been sacked, like in from the tourism industry. They think they are not going to go back to their jobs. They have started doing farming because land is not a problem in Mauritius. Land, they have a lot of land. So the people have started doing farming here, and it is going to make us self-sufficient. It is really incredible to see these people working in the fields.
Awesome. So new beginnings in a way. From in every sense of adversity, there's opportunity. Shruti, last words?
I just think that there's going to be a lot of light at the end of this tunnel. I think with family time and with people trying to get a hobby together, I think that it's going to be a new world, and I think it's going to be change. And I know change is not something we like, but I think it's going to be positive. I'm quite sure it will be.
Awesome. And thanks, Shruti, for being here all the way from Hong Kong.
Thank you very much.
Sonal, how about you? Last words from Singapore.
I think for me, it has been a tremendous personal journey in terms of just simple one word, empathy. For me, it has stopped me from thinking about using global opportunities for investments and earning money and opportunities to just a very human level connect one-on-one. I have from February onwards, I've been writing insistently about how do you deal with this on a very personal level. What are the things you should do, social distancing, because we have seen this happen for so long that India was catching up by the time we entered the beginning of the third month.
Correct.
Where, simple activities like going out to get grocery were filled with so much stress and tension personally. But having said all of that, I think one of the biggest lessons I would take away from this on a very positive note is just the power of community that I have seen in these days. And I have not seen it any better than I have seen that in India. Today morning, I was on a webinar, which was a few government officials and a separate network of people running Feed the Cities initiative. And the kind of stories that came out, every single person sharing a story, I had tears in my eyes, because this was phenomenal amount of work getting done on a basic community level. People selflessly working for 18, 20 hours, sitting at home. And for me, the stories of human resilience, increased empathy, and the fact that human beings can come together as a community to fight something so out of control in that sense. I think it just gives you a lot of positivity. It helps you push yourself towards doing something, even if it's just sitting at home, putting together 20 NGOs you can support and sharing that information, right? Even if it reaches 100 people, 100 people are donating today because of that, right? Any effort that happens, it's creating that sort of feeling of community, of oneness. And for me, that has been like a tremendous positive takeaway from all this. We have finally stopped thinking about money, about careers, about opportunities, about just space with which our lives were going. We've slowed down to be there for one another, even though we are not physically with one another. And I think that's tremendous for me.
And that's something that Mr. Dubey and Mr. Bindra both said, that it's definitely a time that you can use to kind of press that reset button.
Absolutely.
For sure. Last but not least, Mr. Ashutosh from Dubai, your last positivity on behalf of Dubai.
Yeah, definitely. I'm totally agree what the people say about that. Whatever be the condition, the world will not stop. It always find a way to move on, either physically or virtually. So everybody is moving virtually. So that will be the future, definitely. Even as a business continuity plans, many of the companies are coming up with a rotating staff. Even I have seen, I just discussed with one of my friend in Singapore, and one is in Australia also, and in Dubai, in India. Every corner of the world, companies now planning to implement rotating staff, that 30, 50, 60, whatever they have. It will be in the office and rest will work from home. And this is how the business will move on. And I hope, wish you all the very best for everyone. That stay safe, stay healthy.
Awesome. Thanks for that. And I think just being the host, it was tremendous hosting all of you. I'm honored that I could get to do it. Thank you for being here despite all your time zones and your schedules. Everyone here is a working professional, so thank you so much. And it just goes to show, I think, especially listening to all of you and listening to what's happening in different parts of the world firsthand from all of you, it just goes to show that we're all in this together. And it is, as Sonal said, a definite true sort of empirical example and moment in history of human resilience, I think. So stay strong, stay healthy. I'll repeat Ashutosh's words. It was a privilege and honor having you as part of the ICANN conversations. And I want to thank you so much for talking to me, and have fun. Namaste.
Yeah.
Thank you.
It was a
I
pleasure.
just did a world tour
Take care.
sitting in my living room.
Thank you so much.
Bye-bye.
Take
Thank
care,
you.
everyone.
Bye. Bye, everyone.